What are chemotherapy cocktails for cervical cancer treatment? Imagine fighting cancer with a team of medicines working together to stop it in its tracks. That's what chemotherapy cocktails do for cervical cancer. These are combinations of different drugs used together to attack cancer cells more effectively. The idea is to use drugs that work in different ways so they can target the cancer from multiple angles, increasing the chances of success while trying to limit side effects. In cervical cancer treatment, chemotherapy is often used in several ways. Sometimes it's combined with radiation therapy in a process called chemoradiotherapy. This approach helps make radiation more effective at killing cancer cells. Chemotherapy is also used when the cancer has spread beyond the cervix or come back after initial treatment. In some cases, chemotherapy is given before surgery to shrink tumors or after surgery to reduce the risk of recurrence. The most common drugs in these combinations include cisplatin, paclitaxel, carboplatin, topotecan, bevacizumab, and sometimes pembrolizumab. Cisplatin is the main drug used and works by binding to the DNA in cancer cells, preventing them from dividing and causing them to die. It's usually given through enrollment for every 3 weeks, with hydration and anti-nausea medications to help manage side effects. Paclitaxel, also called Taxol, stabilizes microtubules inside cells, stopping them from dividing properly. It's often combined with cisplatin or carboplatin, which is similar but tends to have fewer side effects for some patients. Topotecan is another drug that interferes with DNA replication, and it may be used with cisplatin in certain cases. Bevacizumab is a targeted therapy that blocks the growth of new blood vessels feeding the tumor, which can slow or stop its growth. When added to chemotherapy, especially in advanced cases, it has been shown to improve survival. Pembrolizumab is an immunotherapy drug that helps the immune system recognize and attack cancer cells, and it can be combined with chemotherapy for persistent or metastatic cervical cancer. Some common chemotherapy cocktails include cisplatin with paclitaxel, which is a standard treatment especially for advanced or recurrent cases. When cisplatin isn't suitable, doctors might choose carboplatin with paclitaxel. In recurrent or metastatic cases, cisplatin with topotecan may be used. For more advanced disease, adding bevacizumab to the chemotherapy regimen has shown benefits in extending survival. The goal of these combinations is to use drugs with different mechanisms of action that don't overlap too much in side effects. This way, they can work together to kill more cancer cells while keeping side effects manageable. Often, these regimens are given alongside radiation therapy to make the treatment more effective, or they are used alone if the cancer has spread beyond the cervix. It's important to remember that each patient's treatment plan is personalized. Factors like the stage of cancer, overall health, and treatment goals influence which drugs are used and how they are combined. All chemotherapy treatments should be administered under the supervision of experienced oncology specialists who can tailor the plan to each individual. If you or someone you know is facing cervical cancer, talking to a healthcare professional is essential to understand the best options and what to expect from treatment.